My name is Jackie, and I'm a physical therapist here at Meridian Park Hospital. In this video, we're going to be talking about what you can expect from physical therapy and occupational therapy after you've had your surgery. The first thing that I want to reassure you about, more so than anything, is that right after surgery, physical therapy isn't going to bust into your room and live up to our alleged name of physical torturers or, terrorists or anything like that. We're not going to be doing anything crazy. What most people do right after surgery is we get you up, we help you readjust your sling, we walk, we look at your balance, your safety, and then we talk to you about different things like how best to get up and down from a chair, other things like asking your spouse or loved ones for help, and possibly other things like getting into and out of a car. So occupational therapy will also come visit you while you're in the hospital. They play a key role in your rehab because they're the ones that talk to you more so about your everyday activities. They're not there to try and get you a new job, occupational therapy. It's the activities that you do every day, getting dressed, taking care of yourself in the bathroom, showering, making sure that you can carry food or take care of yourself, wash your hair, brush your teeth, that sort of thing. The occupational therapists also look at your safety. We want to make sure that when you go home, you have everything that you need to be successful. So you may be having multiple people ask you, who's there to help you? Can you get help with this? Can you ask somebody about this or that or the other thing? The only reason we're doing that is to make sure that you're safe and that you're successful. They might do some things that overlap what the physical therapists have done, but that's just because we all want to make sure that everything's going okay for you before you leave. So when you get out of surgery, you might wake up, feel a little groggy, and you might not be able to feel your arm. This is totally normal. And it might be best that you can't feel your arm at this point in time. Your arm is likely already going to be in the sling right after surgery. Once physical therapy and occupational therapy get you up and moving, we'll make sure that we educate you on how to readjust the sling, where your arm should be positioned, and how the strap should be positioned. You may have a very simple sling with one strap, maybe two. Other slings get very complicated. They could have 3 or 4 straps and maybe like a weird wedge that goes underneath your elbow. So we'll talk to you all about that, and that's one of the things that most people have the most questions about. When you're completing your exercises, there are some of them that you can do in your sling, and then some of them you have to do with your sling off. The first exercise that we'll have you do is opening and closing your hand. It's very simple. Like I said, you can have your hand in the sling or out of the sling down by your side. You can also wiggle your fingers if you would like. There's no limit to how often you can do these. It's really as per comfort. This will help keep blood flowing in your hand and forearm and really keep the muscles kind of more limber. The next exercise is moving your wrist backwards and forwards, almost as if you're knocking on a door. Easy, right? The next exercise after that is moving your hand up and down as if you're shaking someone's hand, an awkward shake of the hand. Again, these are unlimited. You can do as many as you would like with your hand and wrist. The next exercise is working on your elbow and straightening your arm and bending your arm. The thing that you're going to do is take off the sling, let the arm hang down by your side, and you can be sitting or standing for this exercise. Some people like to have the sling off while they're doing this lying in bed. This gives them an extra sense of security and comfort because the shoulder is then supported. To do this exercise, very simple. You're going to bend the elbow and straighten the elbow. If you need to, you can use your other hand to help raise or lower it slowly. Some people have a difficult time bending the elbow because it doesn't feel real good, and maybe they haven't been moving their elbow as much as they could have been. Other people have a hard time with the control of the speed when they let their arm go straight. So having the other hand available to assist to slowly lower it is going to be helpful at times. The next exercise that we'll be doing right after you do the elbow movements is called dangling and then moving into pendulums. While you're dangling, the arm is going to be out of the sling, hanging by your side. Maybe if you're leaning forward a little bit, either sitting in a chair or standing up. The idea is that the arm hanging down by your side is going to relax the muscles a little bit, stretch things out, and give you a little bit of repositioning for relief of pain or discomfort. After you've dangled maybe 1 or 2 minutes or so, you'll move into pendulums. Pendulums are kind of like a grandfather clock where your arm is moving from side to side or forward and backwards using momentum. We don't want you using your shoulder muscles to do this action, but sometimes that just happens as a matter of course. Try not to use your muscles though. Next, we're going to talk about choosing a chair or a sitting surface. Typically, we encourage people to choose chairs that have armrests because it's easier to get up and down. Whichever arm might be in the sling, you want to use the opposite arm to push on the armrest to help you get up. Your balance might be a little bit off with the combination of pain meds, the arm being in a sling and unable to be moved, and maybe you're just feeling a little stiff and sore. So having another hand to help you is going to be important. After your shoulder surgery, you may wonder, should I be sleeping in a bed? Can I sleep in a bed? Or should I sleep in a recliner or on the couch? This really depends on the person, how your home is set up, and what you feel most comfortable with. A lot of people elect to sleep in a recliner or a chair. Typically, what we do is we talk to you about how to position yourself when you are sitting in the chair or the recliner. And if you choose to sleep in a bed, we'll go over how to position yourself with pillows and supports for that. Your physical therapist or occupational therapist might recommend some equipment for you to use while you're recovering. This is just to make your life easier and safer. Things that we might ask you to use could be as simple as a cane, or it might be something like a reacher grabber thing that helps you pick things up more easily. Next, we'll talk about getting your shirt on and off. This is going to be kind of a difficult process at first because you're not going to want to move your shoulder. You might be a little afraid to move the shoulder or worry about, am I going to mess anything up? So what you're going to do is you're going to start with your sling off. Just like you would remove it to do your exercises, you take your arm out of the sling, you let your arm hang at your side, whether you're sitting or standing, and then you're going to lean forward a little bit so that you can thread your arm through the armhole. With this, you may want a little bit of help depending on how well you can reach your other arm. Some people have problems with both of their shoulders, so you may need help. Once you have your arm in the sleeve, you'll have to find a way where you can get your other arm around the back of your body to get the other arm into the other sleeve. This might take a little practice, it might take a little time, but you could probably even try it before your surgery if you have time.